Dr. Fauci says we should be encouraging children to get vaccinated against the coronavirus. Nearly 17 million kids as young as 12 years old are now eligible for a coronavirus vaccine in the U.S. It follows the CDC's recommendation on Wednesday. But while some parents are eager to get their children inoculated, polls show that others are still very much on the fence. Mola Lenghi reports.
Happy Vaccine Day.
Tonight, the White House rolling out the first coronavirus vaccination campaign ever to get kids to roll up their sleeves.
We are putting every resource possible to bear to reach people who aren't vaccinated yet.
It's that quick.
Young people arrived at Children's National Hospital in Washington, D.C. today for the first dose of the Pfizer vaccine after the CDC recommended it for kids as young as 12.
I'm waiting for this moment for a long time.
Nearly 6,000 parents began pre-registering their children about a week ago. Helen Quick was with her sons, 13-year-old Cooper and 15-year-old Turner, when they finally received their shots.
I'm just so thankful to be able to avail ourselves of this amazing vaccine and get these kids back to being kids.
But health officials across the country still have a ways to go to convince everyone to get the shot. A recent survey by the Kaiser Family Foundation revealed that only 3 in 10 parents with children ages 12 to 15 said they would get their child vaccinated as soon as possible.
It didn't hurt at all. It was worth it.
But for kids like 14-year-old Hector Knox, today's shot in the arm is a big relief.
I'll be able to travel more freely and interact with my friends.
12-year-old Jacob Balagun's reason to get vaccinated was simple.
It's definitely a good thing. You don't want to get COVID.
Well, the CDC tells CBS News they are now working to revise guidelines for summer camps and for schools before the fall. But it is important to note that children under the age of 12 are still treated as unvaccinated and should continue to wear their masks, Lana.
Mola, thank you for that guidance. Dr. Taison Bell joins me now. He is a critical care and infectious disease physician and the medical ICU director at the University of Virginia. Dr. Bell, thank you, of course, for being here again. As we've been reporting, the CDC has lifted mask and social distancing recommendations for anyone who's been fully vaccinated. The new guidance applies to most indoor and outdoor settings. What do you make of this? Were you expecting it to come? And tell us a little bit more about how the science is supporting this decision.
Well, I will say I was not expecting this news, especially 2 weeks after they had recently updated prior guidance. But I do stand by the fact that the science does support the notion that people that are fully vaccinated are far less likely to have severe disease from COVID-19, and they're far less likely to transmit disease. I think what people are having issues with, and I've spoken with many people today who have reservation, is that the conditions on the ground are very different depending on where you are. So there are some states that have well over half of people that have received their first dose, and many states that are well below that, where you may not necessarily feel comfortable being indoors without a mask on. So I think, the CDC is trying to make a bold statement. In fairness to them, I think they were going to take heat no matter what decision they made. Just a few days ago, they were being criticized for being behind the science and not being aggressive enough. And I think some people may criticize them now for being too far ahead. But I think overall, the numbers in the country look very good. Our cases are going down. Our percent positivity is down. And I think this is a good step.
Well, you alluded to another problem, and in fact, the head of the CDC also emphasized the importance of unvaccinated people to continue wearing masks. But with this guidance now, the concern is that unvaccinated people, as well as vaccinated people, will be taking off their masks indoors and outdoors and no longer social distancing. So what are the risks for those who haven't gotten the vaccine, particularly if people around them have?
Sure. So we know that people who are not vaccinated, do have they are at high risk, particularly if you have some of these underlying chronic conditions. And so the message from the administration is, if you are high risk and you haven't received your vaccine yet, guess what? There'll be people around you who don't have masks on, and so you better get yourself protected. We don't want to depend on others to be protected and others to protect yourself. I really hope that this is that impetus that people that are on the fence to go ahead and protect themselves. So that they may not get sick from COVID-19.
Well, Dr. Anthony Fauci is also urging parents to get their children vaccinated, but he also said that he's, quote, not so sure that it should be required. I wonder if you were surprised by this response, and what would you say to parents who may be hesitant or may be looking for some guidance about whether or not to get their children vaccinated right away?
Well, I'll say that I have 2 young children. They are not of age yet to receive the vaccine, but as soon as they are eligible, they're going to be at the front of that line. It is important to note that children do tend to do well, even if they are infected with COVID-19. But especially because of the variants that are circulating, they're more likely to spread. So, for instance, in the past week, a quarter of new cases were made up in children under the age of 18. So if we want to achieve this notion of protective immunity, we really need to have children as a part of our overall solution.
Dr. Bell, you just said protective immunity. Is that the same thing as herd immunity, or is that something that's different?
I think, I think the point to make is that I don't think there'll be a national declaration of herd immunity because so much of this is local. It'll depend on what's going on in your community. If cases are down, hospitalizations are down, percent positivity down, that'll be much more informative of, what the actual risk is compared to what's going on nationally. And so I use that term carefully to demonstrate the notion that this is an ongoing concept, meaning even if we have made a good step towards progress, we're still going to look at cases, we're still going to track things, still going to test people, and have that willingness to go back and rein things in if we need to in order to keep people safe.
I think there's a very important point in what you're saying here, in particular that we're talking about countrywide statistics, countrywide guidance, but we do know that vaccine levels vary very much based off of where people live. And the USDA and the CDC are launching a vaccine confidence effort in rural America. They're going to be providing immunization education, according to them, to these communities, as well as making vaccines more accessible. Talk to us about the importance of this effort.
It's very important because at this point now, for the most part, we vaccinated the people who have access and who have been eager to get vaccinated, but that's not enough. We have to get way more people to get to that level of herd or protective immunity. And that means a messaging campaign to make sure that people's concerns are allayed, that they can see people in the community that that they respect and love getting vaccinated as well. And this has really been missing from our national outreach effort. I haven't seen a national campaign designed to reach out to people to this scale. So I think it's very important. According to our survey, 6 in 10 Americans say that they will or have received at least 1 dose of the vaccine. That means 4 out of 10 are either on the fence or outright no. And we need to get that number more and more to the side of getting vaccinated. So anything we can do, I think, is a good step. I'm also a big fan of what Mike DeWine's doing in Ohio to incentivize people to get vaccinated.
Before I let you go, I want to ask you about what the World Health Organization said. They had a panel that called the coronavirus pandemic a, quote, preventable disaster. I think for anybody who has lost a loved one during the course of this pandemic, this is a punch in the gut. Do you agree that this was preventable, and what lessons has this crisis taught us?
Well, I think there are certainly lessons to be learned whenever there's a public health disaster. And I think this report is a very important step towards that. And we could finger point, back and forth. I know the WHO, the report also said that February was a lost month where governments could have gotten a handle on the pandemic at that point, or they called it epidemic at that point. But it wasn't declared a pandemic until March. And so that would have been an important step as well. But I think, the notion that we can prevent these, I think it's more towards mitigation. There's an estimate that there are more viruses on the earth than there are stars in the universe. And so instead of focusing on prevention, what we need to do is have a rapid action plan so that we can quickly jump on, test, trace, and isolate, and be able to implement clinical trials and do what we need to do to keep people safe. I think what this report underscores is that on a national, international, and local level, public health infrastructure is severely underfunded, and we definitely have to fix that.
Dr. Taison Bell, as always, thank you for being on, and thank you for all that you do.
Thank you.